Hello friends, are you someone who is suffering from Bell's palsy and synkinesis and is wondering why my corner of the mouth is problematic? Sometimes it just droops down, sometimes in the chronic cases it pulls up, and you will feel that the corner of the mouth is not moving ideally the way it used to move before. So today I'm going to discuss about one structure that's causing that asymmetry at the corner of the mouth. And that structure is called as Modiolus of face. So let's understand what exactly it is, how it impacts your facial symmetry when you suffer from Bell's palsy or synkinesis, and I'll give you 5 practical tips that you should follow in order to work on your modulus. So let's get started. So friends, by definition, modulus is a structure which is around the corner of the mouth. This is a center point, or else you can say an intersection of around 9 facial muscles. This is the point where all these facial muscles insert, or else you can say ends, and all of them are connected together at this particular spot, forming it as a dense tissue. That's why if you push your corner of the mouth, you will see a certain kind of tension being present, which keeps your mouth mobile and in shape. But when you suffer from Bell's palsy, since these muscles are paralyzed, the insertion point also loses its strength. At the same time, it loses its tone, that resting tone that is needed. This particular structure acts as a vital anchoring point for your facial expressions like smile, disgust, wider smile, moving your mouth away from the lips, and downward movements. All of them are anchored from this place. That's not all. Functionally also it plays a very crucial role in your speech, in your swallowing, and in your chewing process. That's why not only in facial rehabilitation, this particular structure plays a very critical role in dentistry, in plastic surgery as well. So there are at least 9 muscles that are ending here and forming this structure. The name of these muscles are zygomaticus major, orbicularis oris, buccinator, levator anguli oris, and depressor anguli oris. So these are the primary muscles, but there are some supporting muscles that are somewhere indirectly attached to this area. These muscles are zygomaticus minor, risorus, and depressor labii inferioris. And all of these muscles which I mentioned right now are impacted or paralyzed because of Bell's palsy. So imagine when these muscles are paralyzed, the area where these muscles end will become weak and giving you that facial asymmetry and droopiness. Now what happens is when a person suffers from synkinesis, there are uneven forces that are running around these facial muscles. This is because of 3 major reasons. Reason number 1, the aberrant regeneration. What do I mean by that? That your nerve kind of miswires with each other and they will contract at the same time trying to help each other. So this creates a situation of tug of war. For example, whenever you are trying to smile, your smile muscle gets activated, at the same time your downward pull muscle also gets activated, creating that situation of tug of war, and you feel that you are not able to activate the muscle enough. Similarly, the other problem is facial co-contraction, where more than one muscle contracts to help each other. So when you try to smile, apart from your smile muscle activation, the adjacent muscle will also start to contract, trying to help them, causing a tug of war situation. And last but not the least is the cortical reorganization, which means the brain starts reorganizing itself to make these movements happen, changing or altering these patterns. Now all of these impact this particular structure, affecting your symmetry of the face. Due to this, there are some clinical issues or functional challenges that a person will face. Number 1 is impaired facial expression. Obviously, you will see that when you try to smile, your smile is not going in the right place. Similarly, pucker will be difficult. Expression of sadness will be difficult. Rolling the lip like this will be difficult. All of this is happening because of the weakness and stiffness in this region. Next problem is that unnecessary pull is getting overpowered in the downward direction because of impact of gravity further, which makes your face pull down and it starts affecting your neck region, giving you neck pain and the pain in the backside of the ear, which is somewhere coming because of the pull from this region. So these are some clinical implications that happens. Now, if I talk about acute Bell's palsy, or you can say early Bell's palsy phase, these are the three issues that happens here. Number one, loss of tone. So since these muscles lose its tone, they are very weak, the muscle will not hold here and your face will completely droop like this. And that's why someone who has acute Bell's palsy, their face is completely dropped down. There is no tension that is holding this lip and the center. Second, there is a mechanical collapse of these muscles. These muscles lose tone, so every muscle pulls down, and there is a heaviness and sensation of downward pull that is being felt by people and making this talking, chewing, eating, smiling difficult. Same way when I talk about synkinesis, the aberrant regeneration leads to wrong pattern development. So whenever you are initiating your smile, the vector forces of other muscle also pulls, causing action of expression more and more difficult. This leads to this tug of war situation, limited smile, due to which some people feel that they have not healed or recovered from Bell's palsy, but instead of that, it's just that miswiring that is causing this limitation. And last but not least, you lose your facial coordination. So this is the most important one. Since your face is not moving perfectly or the way it was moving before, you start relying more and more on the good side of the face, and the good side starts becoming overactive and over strong, making your facial symmetry look far more asymmetrical. So how do we deal with this condition? Now there are very few options to work on this, but here are them. The number one comes here is chemodenervation or Botox. Yes, that you heard me right. So in Botox therapy, what it is done is the overpowering muscles on those areas or on those muscles, Botox is given to reduce the overpower, so that when you train these muscles, they can be trained well. And the most important rehab part here is your myofascial release and your neuromuscular re-education. This is the cornerstone of every rehab. Yes, it is time consuming. Yes, you need to be very patient when you work on this, and you need to be very consistent and very focused when you work on it. But it is worth it, because when you work on it, you would be able to prevent that undue damage that comes along with the stiffness of this of Modiolus. Which is this damage that I'm talking about? Well, when these muscles are not used enough, they start shrinking and getting atrophied in a chronic situation. When that happens, the atrophy leads to shortening of these muscles. First visible change that you will see is your lips will start becoming thinner. You will also observe that this upper corner here will start becoming thicker in nature, not freely, and you will feel that it's very tensed. When you try to touch it from inside also, it will feel very hard. Now this continues increasing and increasing day by day if you don't work on the structure with the help of myofascial release techniques. So the therapy or rehab for this particular structure is extremely important, and in fact, we believe that whenever someone comes to us for Bell's palsy or synkinesis rehabilitation, this is the spot that we focus a lot on. Because if we can work on this, then a lot of things can be achieved. Now, let's come to those 5 tips that I wanted to give to work on your Modiolus. So number one tip is, first you need to understand what is the problem with this Modiolus. Is it pulling downward or it is drooping downward? Now these are two different things. When you say drooping downwards, that means you are suffering from this acute Bell's palsy. Your face is completely paralyzed, it's drooped. At this stage, stiffness will not have been developed, it's just that lack of tone pulling it down. In this stage, what you need to do is you need to do supported lifts in this region so that you allow this Modiolus area to be in that center position where we want. That's your tip number one. Tip number 2, let's say you have a chronic Bell's palsy and you have developed synkinesis, then you need to check, is it stiff or hard? If you have that feeling of stiffness or hardness in this region, then you need to hold this and you need to do the circular massage and try to free it up as much as possible. Make sure that you keep this free and do this practice multiple times so that it stays relaxed. Tip number 3 is to give warmth in this region, because warmth helps in reducing that stiffness and tightness. So applying warm compress from outside, at the same time keeping some warm water inside your mouth and just like to be there. This will help to reduce and relax those areas. Then comes tip number 5, and which is the most important one, is to mobilize this corner of the mouth along with this. So you can do practices like pulling, pushing, pulling, pushing, up, down, and circles, clockwise and then anti-clockwise. So when you do this, what you are doing is basically you are mobilizing the structure, and your brain is subconsciously comparing with your good side, giving you an understanding how this is moving. As I mentioned, this is one of the most critical structure when it comes to facial rehabilitation, and we give utmost importance to this area. So if you are someone who feels that this particular modulus has a problem which you are not able to figure out, feel free to reach out to us so that we can help you better. On that note, I'll end this video here, and I'll see you in another video. Thank you.